Okay, my hands are washed. My name is Michael. I'm an occupational therapy student at University of St. Augustine. Before we begin, what is your name and date of birth?
Jeannie Sante, 8/31/75.
Okay, all right, that checks out. So my plan for you today is before we do therapy, I want to be able to check your respiratory rate, your heart rate, and your blood pressure.
Okay.
Is that okay with you?
Yeah, sure.
All right, so I have your consent, all right?
Yes.
Okay, all right. So when it comes to heart rate, your normal range is between 60 to 100. And there's 3 different places we can take it. We can take it in the carotid, we can take it in the brachial, and we can take it in the radial. And so for today, what I'm going to do is I'm going to do the radial side, and I'm going to do it for 30 seconds. So I'm going to look at the clock, and I'm going to start counting your beats per minute,
Okay.
per 30 seconds. And I'm going to times it by 2.
Okay.
All right. So I'm going to find it first. Okay. And I'm going to wait until the clock hits, and then I'll begin. Okay. So I just want you to just stay relaxed and try not to speak. Okay, all right. So I got 31. So we times that by 2, it gives you 62. So and you're in the normal range, which is 60 to 100.
Okay.
All right. So the next thing I'm going to do is I'm going to just I'm going to check your respiratory rate, but I'm going to check your heart rate again. Okay.
Okay.
Okay. So I counted 6 times. So we multiply that by 2 because it's in 30 seconds. That'd be around 12. So the normal respiratory rate is between 12 and 18. So you fit in that category, which is good.
Glad to be normal.
Yeah, definitely. So the next one we're going to do is we're going to do blood pressure.
Okay.
So when it comes to blood pressure, the normal range is around 120 over 80, so 120 systolic and then 80 diastolic. But before we begin, we're going to check out what your occlusion point is.
Mm-hmm.
And how we do that is I'm going to put the blood pressure cuff on you, I'm going to pump it up, and I'm going to be checking your radial artery. And then whenever I can't hear it beat anymore,
Mm-hmm.
that's when we know that's where our occlusion point is. So when we take the blood pressure, we're going to start up 20 to 30 millimeters of mercury above that, so that when I take it again, that's where we will begin at, and then we'll come back down
Okay.
slowly. Okay. All right. So I've already cleaned these off prior to, and I'll be cleaning them afterwards as well. Yeah, I'm gonna bring that table over. I'm gonna go on the other side of that table.
Okay.
Slide her up, she slid down a little bit.
Oh. My feet on the floor.
Yeah, don't cross your legs. Make sure your feet are on the floor.
Let's see how low I can go.
Yeah, and when we do the blood pressure, we're going to make sure we get it close to about your where your heart level is. But if it doesn't feel comfortable, we'll just kind of keep it at this level. So whatever you prefer. Your occlusion point was at 130. So we're going to give you 1 minute of rest before we take your blood pressure. Okay.
Okay.
All right. Okay. All right. A minute has passed. So the next thing we're going to do is we're going to check your blood pressure. What we're going to do for the blood pressure is we try not to talk as much so I can hear a little bit better. We're going to make sure our feet are flat on the floor. We're going to make sure we don't cross our legs either. Okay. And then after I finish this, I'm going to clean this stuff up for the next patient that I see. And then so we got the table about heart level. So I want you to feel relaxed. This thing keeps sliding down on me. Okay, keep it about 1 inch. All right, and just relax. All right, so blood pressure was a little bit elevated.
Uh-huh.
It was so when the occlusion point, so the occlusion point was 130, and so what we do is we go 20 to 30 millimeters of mercury above that. So we were starting at so it was 130, so we were starting at 150, and then so I started coming down, and maybe I got you excited, but it was 135 over 80. So the normal range is 120 over 80, so it's considered high, but you know, it may have been because, you know,
I'm trying to suck my belly in the video, so.
That could have been it. That could have been it.
Yeah.
But we'll maybe wait a couple minutes and we'll check it again.
Okay.
Just to see if it gets a little bit better. But thank you. I appreciate everything you're doing for me.
Sure thing.
All right.